An important trend in the False Claims Act space is that private equity firms are being named as defendants in False Claims Act cases due to business trends. We are witnessing this trend because of increasing control and influence by private equity firms on healthcare, whether it's hospitals, pharmacies, your dental office, or your dermatologist's office. Private equity is making the investment and sometimes having day-to-day control over the operations. Healthcare providers operate in a heavily regulated environment and may rely on significant state and federal reimbursement. This brings them within the scope of False Claims Act risk. Under the False Claims Act, a whistleblower can file a lawsuit on behalf of the government, alleging that the defendant submitted false claims for payment to the government. This is important for private equity firms because to the extent they're involved in the day-to-day operations of a healthcare provider, they can be on the hook for causing the submission of such a false claim for payment. At every stage of its involvement, starting with due diligence to maybe an oversight role as a board member, the private equity firm should be focused on all of the regulatory obligations concerning the government contract and the promised services. These are complicated spaces, and regulatory attorneys should be involved early and often. Having served as a federal prosecutor, I am able to step back and see the broader context. I understand how a prosecutor builds her case, and I also understand what their concerns are. This allows me not only to vigorously defend my clients, but also to give them advice to avoid potential issues.